Hi friends, this is your friendly neighborhood pediatrician Dr. Aditya Bhatt, and today we'll discuss something about the monkeypox virus. Now, the monkeypox virus has recently been declared as pandemic as of making of this video today. It has been declared as a pandemic, and so it is important to know about the virus. So the virus monkeypox was discovered in the early mid 1900s, and it is from the family of orthopox virus. Now the other members of orthopox virus are the smallpox virus and the vaccinia virus that was used, the cowpox virus that was used to make the vaccine for smallpox. Now ideally the disease began in the Congo region, which was in Central Africa, and a natural host of monkeypox virus has been thought to be the rodents and squirrels and pouched rats and non-human primates are also affected with these disease. Now, the first human monkeypox was identified in 1970, and it has since then been recorded multiple times. Now, the transmission can be from animal to human and human to human by the direct contact with blood or the fluids or touching the cutaneous blisters and the lesions. Now, ideally, it has been said that the fatality rate of this disease is 3 to 6%, which is more in immunodeficient population. Now, we'll talk about signs and symptoms. So, the incubation period for this disease is around 5 to 21 days. It is a variable range. Initially, the clinical features began as the prodromal invasion period, in which lasts for 0 to 5 days, where there is fever, malaise, weakness and muscle pain and joint pain. But the significant feature which differentiates the this disease from smallpox and chickenpox is that this disease has a significant proportion of lymphadenopathy in the even invasive period. If the patient has lymphadenopathy, then it is very less likely that it might be pox or smallpox. It is more common, it is more likely that this patient has monkeypox. Now, after the prodromal phase, 1 to 3 days, the rash begins. The rash is initially flat macule, then it converts into papule, vesicles, pustules, and then it might break and the skin will get desquamated. Now, the most common part involved with the rash is the face, and then the second most is palms and soles, which is affected in nearly 75%. Conjunctiva, genitalia, oral mucosa also involved. Now, there are multiple complications of this disease, and they are nearly same as the complications of chickenpox, like bronchopneumonia, sepsis, encephalitis, and there is corneal ulceration. The diagnosis is done by PCR of the scrapings of the crusting or the scrapings of the local lesions. But they are very difficult to differentiate from the other vaccinia and variola, smallpox and cowpox. So they should be diagnosed in short duration. Now, there is one drug that is licensed this year for treatment of monkeypox called tecovirimat. This tecovirimat is approved in Europe. It is not available in India as of now, and India has not still approved, though it might be approved later on by Drug Controller General of India. Vaccination of this virus is vaccination for this disease was actually thought of that initially the population which was vaccinated against smallpox was resistance or was immune to this disease. Now the newer generation not been vaccinated against smallpox, so it is thought that this disease is making the resurgence. So the vaccine for this disease is originated from the 2019 Ankara strain. Ankara is in Turkey, so Ankara strain of cowpox has been the source of the vaccine for this disease, and 2 doses have been recommended. So this is all for today. If you like the video, please like, share and subscribe.